presents an excellent opportunity to reflect on the progress, to consider the challenges faced as we plan to grow, on how to continue to deliver effective and good quality services to patients in the country. For the last 6 months, we have witnessed a number of our healthcare workers contract the virus, with some succumbing to the disease. And apart from COVID-19, it is important to remember, as our healthcare workers serve us, they continue to be exposed to other infections, including but not limited to hepatitis B, HIV/AIDS, tuberculosis, assaults, and other challenges that all emanate from their noble service to humanity. And so as government, we continue to support them. During this COVID pandemic, we continue to ensure that they are adequately trained, that they have the adequate and timely supply of PPEs, and that their mental well-being is taken care of by providing psychosocial support services for them. We also continue to maintain an open-door policy for them to be able to engage with us, to share their experiences, to curate lessons that they are learning, because remember, they are the ones who are in the front line, and to also listen to their grievances and together create solutions towards this. With regards to the policy framework for patient safety, the Ministry has put in place a comprehensive, safe and quality policy framework that ensures that patient safety and healthcare worker safety is ingrained at all levels of government, at all service delivery points. And to this end, this policy would not be possible without the critical role that is played by our regulatory bodies, particularly noting the role played by the Kenya Medical Dentists and Practitioners Council, the role played by the Nursing Council, the Pharmacy and Poisons Board, as well as the Clinical Officers Council, and all the activities therein that touch on health worker safety. And so we thank these regulators for their commitment and for paying attention to safety and quality for our healthcare workers. We would like to remind you all that a safe health worker means a safe patient. And so turning on to the COVID-19 situation, today from a sample size of 4,188, we have gotten 183 people positive, bringing our total case cost load to 36,576. Of these cases, all are Kenyans except 14 who are foreigners, with the youngest being a 7-month-old infant and the oldest being 80. And in terms of gender, 131 are male, whereas 52 are female. In terms of disaggregation by county, we have Nairobi County leading with 54, Kisumu County follows on with 26, Mombasa has 20, Trans Nzoia 16, Kericho 11, Nakuru 10, Kisii 7, Machakos 6, Meru 5, Turkana 5, Lamu, Nyeri, Siaya, Kiambu have 3 cases, Kajiado, Busia, Homa Bay, Kilifi, and Samburu have 2 cases, whereas Kakamega and Embu each have 1 case. We have provided you with a disaggregation by sub-county. For Nairobi, just touching on that, of the 54 cases, we have 10 coming from Starehe and Westlands, and disaggregation of the subsequent counties is provided. In terms of our recoveries, today we have 82 people that have recovered from the disease, 33 from the home-based care program, whereas 49 have been discharged from various health facilities. And so with regards to total recoveries, we stand at 23,611. And as mentioned earlier today, celebrating healthcare workers, noting that their safety is important, we continue to thank them and appreciate them for the good work done. With regards to our fatalities, sadly, we have lost to the disease, bringing our fatality to 642. And we extend our condolences to the family and friends of those who have lost their loved ones. And finally, as we commemorate this day, we would like to inform you, to date, since the beginning of the pandemic, a total of 945 healthcare workers have been infected with the virus, whereas 16 of these have succumbed to the virus across 35 counties in the country. We would want to appeal to all Kenyans, in respect and in honor of our fallen 16 healthcare workers, that we can observe 1 moment of silence. Thank you. We continue to celebrate our healthcare workers. We would now like to have a question and answer session.
Good afternoon. I'm Purity Musa from KBC. My first question regards the county paralysis of services, including healthcare services. I think this compromises the fight or the response, the COVID-19 response. What next, especially from the Minister of Health, and having over 36,000 cases of COVID-19. And also, healthcare workers continue to down tools because of different claims, including salaries. Today, we witnessed patients being returned home at Kiambu Level 5 Hospital. Again, what are you doing as the ministry to protect healthcare workers to ensure that their needs are being met? And also this issue of the counties paralyzing their services. Is there anything that you are doing to also come in and help, especially in the fight against the coronavirus?
Hello, my name is David Mudhoka from TV47. Picking up from where Purity left, indeed today we've seen a number of county hospitals partially closed where there are no new inpatient admissions and the outpatient admissions are done are scaled. Is the ministry aware of a number of hospitals, and are there efforts to make sure that this does not persist, especially on a day that today we mark the World's Patient Safety Day? The safety of our patients is at risk with the ongoing and that sundown that began today.
I think Kaimba wants to say something. Yeah.
Okay, thank you. Maybe I'm Haimba from Ebro TV. Kindly, Dr. I don't know whether up to until now, as the cases continues to decrease, do we have any hope for medication of COVID-19 up to now? Any lasting solution towards it?
Thank you. Thank you, Aimba, for that question, and Purity and David Madoka. With regards to, is there any magical pill, that has been discovered for COVID-19? Trials continue across the world. The last promising news that we shared with you the last time was on dexamethasone, which is a common drug that is utilized when it comes to different ailments, and that had been shown to actually have positive outcomes, reduced length of stay in hospital for COVID-19 patients. I'm aware new trials continue for different medicines, and the DG will be able to expound on any new drug. But with regards to a pill that can completely cure COVID-19, we are not there yet across the world, and these efforts are still underway to try and see if anything will be found that can actually be a remedy for COVID-19. But it becomes important, Aimba, to remind us that perhaps the biggest cure is the three things that we talk about. The hand washing, the social distancing, and the face masking are very crucial and are perhaps what we call non-therapeutic measures of actually defeating COVID-19. And we continue to remind all Kenyans to continue observing these measures. When it comes to the question, and these are, two-in-one questions by David on hospitals continuing to operate, and the issue of low hospital admissions, new admissions. This morning we've had discussions with various county governors who have actually impressed upon us the need to ensure that there's continuity of essential health services. And so I'm aware governors are standing on to ensure that if someone needs that critical service, that service will be available. Any issues that may be happening in any hospital pertaining payment of any salary arrears, issues of promotions are being handled through the mechanisms that are there. But I can give you assurances from the discussions we've had in the morning, hospitals are operating, that service is available for you. And then most importantly, our leaders continue to debate and come out with a solution for the current standoff. And so I'm sure everything should end out, panning out correctly. This morning, particularly in Kiambu County, we were able to discuss with the governor and things are going on accordingly. And so no fear, these services are there. The doctors are there, they're waiting for you. The nurses are there, they're waiting for you. The hospitals are running. This is an absolutely crucial and essential service when it comes to COVID-19, but also when it comes to the health of our nation. I think I would like to have the DG really jump into the issue of any medication, anything in terms of, drugs. Is there any advancement in terms of the different trials that are underway?
Thanks, Madam CS. As you have clearly stated, so far, no specific pharmaceutical intervention that can be able to cure COVID-19. However, significant progress has been made in trying to use a combination of various pharmaceutical agents to be able to reduce the chance of death and also the morbidity associated with COVID-19. And as you clearly have stated, is one of them, of course, is dexamethasone, which showed significant use, especially those who are in critical care, by reducing mortality by about 30%. Our doctors are also using other antiviral agents, including favipiravir, remdesivir, and a combination of these to reduce the chances of death for critical care patients and also to reduce the average length of stay either in ICU or hospital setting. So far, no clear bullet, but this combination of drugs have helped certain patients, but not all of them. But as Madam CS clearly indicated, our focus for now should be on infection prevention control and the public health social measures, including avoiding gatherings and ensuring that we maintain physical and social distance and wearing our mask when we're in public places. Of significance, of course, is also the work that is being done in vaccine development. As of today, there are 5 vaccine candidates that are in phase 3 trial, which is the final phase of any trial on vaccine development, with very good promising results, including the Oxford AstraZeneca vaccine, the Moderna vaccine, the Chinese vaccine, and two others. And we are hopeful that going forward, in the next few months, maybe in the next quarter 2, quarter 3 of 2021, we could have a vaccine in place. But remember, the process of vaccine development, the vaccines is also a huge logistical nightmare. So that is why Kenya has joined the rest of the world in what we call the COVID vaccine facility or COVAX facility under the leadership of WHO and Gavi, the Global Vaccine Alliance. This is to ensure that the rest of the world consolidate together to ensure that we develop one common vaccine, develop a platform of delivery. Remember, even if you get the vaccine, it will not be possible to immunize all the 6.5 billion population of the world in one go. So even when we have the vaccine, we'll have to prioritize. And of course, the healthcare workers will be at the top of the priority, and those with the morbid conditions, and of course, the other vulnerable conditions, including those who are over 60. So getting the vaccine is one thing, but getting it to the people who require it will still remain a challenge. And that is why the global community has come together with a budget of about $37 billion. Unfortunately, we have only raised 10% of that money to ensure access and equity once the vaccine becomes available. But also to warn is that there's also what is coming out as vaccine nationalism or protectionism, where countries, and I'll not mention that specific country, is really trying to ensure that they have the vaccine for its own population. But that will not assure the safety of the world, because if we get a vaccine, the best is to avail it to the entire world population, because COVID anywhere is COVID everywhere. Thank you.
Thank you. Thank you, DG.
Familia hizo ziko kwa majonzi